What is a FREC?
So FREC is a standardised qualification that stands for First Response Emergency Care.
Okay, and what is a FREC 3? What does it entail?
A FREC 3 is a really good alternative for something like the First Person on Scene or Advanced First Aid at Work courses. All different sort of basic patient assessment skills are provided in the FREC 3.
So with you saying that people come a bit later in life when they're like security guards or shop workers, why is a FREC 3 more advantageous than a First Aid at Work course?
So the level 3 FREC is a much higher sort of base level knowledge because it's got to adhere to certain standards. So the FREC 3 is more in depth, it covers more topics and it provides a base level of knowledge that you can then build on. Again, it is more advanced, it is more in depth. Hi, and welcome to Basegreen's first clinical podcast. I'm Ruth, one of the trainers and paramedics here at Basegreen.
Hi, I'm Ailey. I'm an aspiring paramedic who currently works in the operations centre, and I'm here to find out more information about Basegreen.
So, how can I help? What questions have you got today?
What is a FREC?
A FREC, great question. I had no idea until I entered into the training and education sector. So, FREC is a standardised qualification that stands for First Response Emergency Care. There are 3 levels to the FREC, 3, 4 and 5, and they are a standardised qualification, and this means an awarding body sets the assessment criteria, the learning content and process of delivery to students so that no matter where you take this course in the country, everyone is receiving the same standard of education.
Okay, and what is a FREC 3? What does it entail?
A FREC 3 is a really good alternative for something like the First Person on Scene or Advanced First Aid at Work courses. It's more in depth, it's more thorough, but it's providing that real sort of foundation of knowledge in emergency care. So things like cardiac arrest management, burns management, all different sort of basic patient assessment skills are provided in the FREC 3. It's entry level, so it starts at the bottom and builds up those knowledge blocks.
Okay, and what's FREC 4?
FREC 4 is more advanced. It goes up a level as we go on. It's a level 4 qualification in its own right. It builds on the knowledge that you've made in the FREC 3 course, so it's more advancing on patient assessment. It's allowing for more intervention and skill, and it's putting more, I don't know what to say. Try that again. What was your question?
What's a FREC 4?
So a FREC 4 course is the next step in your pre-hospital career with the FREC system. The FREC 4 course is a build upon the knowledge that's already been gained and understood in the FREC 3 course. So they both have very similar themes in that they are pre-hospital, they are for things like cardiac arrest management, trauma management, illness recognition. However, the FREC 4 goes into much more detail in anatomy and physiology, into medical gases, and into the skills that you can use and the assessments that you can carry out on patients. So it's more advanced knowledge and understanding.
Okay, so I understand there's FREC 3, FREC 4, FREC 5. Can you kind of skip a FREC?
So like
just go straight into FREC 4?
No, you can't. And that's because with it being a standardised qualification, it's really important that we understand that everyone has the same base knowledge. We wouldn't want someone to come into a FREC 4 and be missing out a huge element or one of the concepts of the education process. So no, you can't just jump straight to FREC 4 or FREC 5. You need to complete the FREC 3 course prior to entering onto the FREC 4. However, here at Basegreen, you can absolutely book both of them together so that you know that you've got, a timeline of your learning. However, there must be a minimum of 4 weeks between the FREC 4 course commencing and the end of your FREC 3. And obviously you must have passed and completed the FREC 3 course first.
Okay, and what do you need to do to pass the FREC 3 course?
So the FREC 3 it's a mouthful, isn't it, FREC? Yeah. The FREC 3 course is... It's got 3 main components to it, and each component has a practical exam and a multiple choice question exam. So in total, there are 6 methods of assessment during the 5-day course, 3 practicals, 3 multiple choice. Also, if anyone fails one of the sections of the course, so one of the practicals or one of the exams, everyone does get a resit. Each component can be resat, so essentially there's support there that if one of you fail one practical and one multiple choice or 2 multiple choice or none, fingers crossed, the learners have got the opportunity to resit during the week, but also The trainers are there to help support, so we can make special circumstances. So if someone's got dyslexia or another form of learning disability or difficulty, we can make adjustments to make sure that we're meeting the learner's needs.
Okay, and what kind of assessments involved in the FREC 4?
So in the FREC 4 course, again, there are a mix of written exams, practical exams, and also coursework. So once the 5-day classroom element of the course is concluded, you are then given 3 workbooks. Now these workbooks cover the knowledge that you've learned during the week, but also some areas that you are told to go with self-directed study. As it's level 4 qualification, there is quite an onus on the learner to have that dedication to self-directed study. So there's these workbooks that you've got 12 months to complete, and they cover all the topics that we've learned about during the week. So it could be anything from scene assessment to cardiology or child assessment, safeguarding. These are all topics that could come up in the workbooks. And each workbook has got 3 submissions, so you can submit it, get feedback, and do that up to 3 times for each workbook until you then, obviously, you don't need any more referrals on your pass, but you get up to 3 attempts. There is 1 written exam during the 5-day classroom element, which is on anatomy and physiology, and there is an ECG exam as well. There is 2 main OSCEs with intermediate life support and trauma assessment, and then some other practical skills simulations, such as assisting the clinician and performing patient observations during that 5-day classroom element as well.
Okay, and based on you saying there's a lot of home kind of study that you've got to do alongside, what's kind of percentage? How much do you expect us to do in the classroom, and how much do you expect us to do at home?
So during the week, there is 39 hours of contact learning time, so classroom time. There's 39 hours over the 5 days of that. There is also an expectation of around 2 hours per day to do self-directed learning at home. This is all discussed in the pre-course handbook. It tells you what areas you should be focusing on each day, as what you focus on one evening would then be reflected on the learning you do the following day in the classroom.
Okay, and what job opportunities can these FREC courses lead you to?
So the FREC 3 and FREC 4 can really help you with sort of a gateway into pre-hospital care. So a lot of the students that come for the FREC 3 or FREC 4 course have got either a desire or current job opportunity with companies such as private ambulance services or private providers. These can be working as patient transport to and from hospital. They can be inter-facility transfer, so taking an inpatient from one hospital to another. There's also opportunities for private events work. Now this could be anything from motocross, car rallies, concerts, filming and TV industry, football stadiums, family fun days. The list is quite literally endless for the private and events sector. But having a FREC 3 or FREC 4 qualification can give you access to those sorts of employment opportunities. Another thing is a lot of people do it as part of an add-on to their current role. So a lot of the students I have could be security guards, bouncers at nightclubs, security at shopping centres. They could be working in a risk environment such as engineering or factories, steelworks. So a lot of large corporations that have got a danger element to their work like to have a number of staff on site with this qualification. So it used to be they'd have a first aider who's done a 1 or 2 day first aid course. However, since the introduction and development of the FREC courses, a lot more big companies are saying actually it's really ideal and really handy to have staff with this knowledge and experience on site, just to help preserve their staff's well-being and safety if something was to go wrong. So the list is almost endless of opportunities with the FREC courses. Another thing is a lot of people who, like yourself, want to be a paramedic but either don't know where to start or haven't yet got the setup to jump straight into a full-time university course. 'Cause in order to be a paramedic, it is a protected title. You can't call yourself a paramedic unless you are one. That is against the law. And you can't be a paramedic with the HCPC unless you've got a degree.
Yeah.
So historically, paramedics could be done on an internal training course with their ambulance service, but we've very much moved away from that now. It's a BSc qualification only. So you have to go to uni and you have to complete the course to the standards that the HCPC dictate. Obviously, going to university for 2 or 3 years is a lot. It's a huge commitment, isn't it? Especially for people who have got young families, who have got mortgages to pay, bills to pay, people to support. So the FREC courses can help give you that taste of the knowledge and give you an idea of if actually as being a paramedic what you want. But also it gives you a foundation of knowledge that it's going to make your transition into university so much easier. A lot of people know they want to be a paramedic but don't have any experience in pre-hospital care. So when they're on their first day at uni, it can be quite daunting, you know, being around people who might have done clinical supporting roles, who might have worked as healthcares in hospitals, or just being in the clinical environment. Just things like the jargon, the medical terminology, it is all quite overwhelming. So coming and doing a FREC course can just give you access to that world. So lots of people do that as well. But also, Basegreen have got a really good relationship with local universities that deliver the paramedic course. So you could do a FREC 4 course here at Basegreen. You can then come back to us and do the conversion to the AAP, which is the Associate Ambulance Practitioner course. And once you've qualified as the Associate Ambulance Practitioner, we can help support with introductions to universities that offer the paramedic degree to do that conversion from AAP to paramedic.
Mm-hmm. With you saying that people come into this a bit later in life, people might have mortgages, kids, is there an element of flexibility with the course?
So QualSafe are our registered body for the qualification, and it's really important that we stick to their guidelines so that we can ensure that every student receives the same level of education, the same knowledge and the same standard. So although there's flexibility in terms of support, you would need to be able to commit to the full 5 days of classroom learning, as we can't be chopping and changing, you know, you're coming in for half a day or coming in late, because you're going to miss out on valuable education. However, in terms of the support afterwards, that is really flexible. So you do get 12 months to complete the workbooks for the FREC 4 course. So obviously that's plenty of time for you to fit it around your current commitments. The educators, again, are really flexible here at Basegreen. If you can only do a call for some feedback or advice on an evening, they'll do the best to meet the times that work for you.
Mm-hmm. So with you saying that people come a bit later in life when they've got, when they're like security guards or shop workers, why is a FREC 3 more advantageous than a first aid at work course?
So the FREC 3 certificate, FREC 3 course is a level 3. That's where the 3 comes from. It's level 3 in terms of the education standard. So if you think of your GCSEs or your O-levels, that's a level 2 qualification. So the level of knowledge and experience and understanding that goes into, say, a level 2 qualification is obviously lower than what you'd expect for level 3, which is equivalent to like college and A-levels. So the level 3 FREC is a much higher sort of base level knowledge, because it's got to adhere to certain standards. So it has to contain certain levels of information, expectations of students learning than a first aid at work certificate. So the FREC 3 is more in depth, it covers more topics, and it provides a base level of knowledge that you can then build on. So it's a really solid foundation. Although it's the entry level point of the FRECs, it's still very in depth. It's still got lots of information there that covers far more topics than your first aid at work certificate. So the FREC 3 is a little bit sort of a similar one to the first person on scene qualification. However, again, it is more advanced, it is more in depth. The good thing about, again, the level 3 FREC is that it's over 5 days. So you can imagine how much information, learning and knowledge we can get into 5 days, as opposed to a 1 or 2 day first aid course.
Okay, so with the FREC 3, what kind of qualifications or experience do you need from us?
To apply?
Yeah.
So the FREC 3, it is entry level, so you don't need any prior experience or knowledge in pre-hospital care and medicine. However, you do need to have a basic sort of level of maths and English, because there is written exams, and obviously in the learning environment we need you to be able to understand the language that's given to you. However, there's no formal qualification, like you don't need a certain grade of GCSE or anything like that. You do have to be over the age of 17 years old in order to complete the course, but there's no other requirements for entry to level 3. Level 4, you do need to have completed the level 3 course and have got some evidence of CPD, as well as you have to have waited a minimum of 4 weeks before completing the FREC 3 to start in your FREC 4.
Okay. What would, if I was to do this course, what would I learn on the FREC 4 that I didn't learn on the FREC 3?
So on the FREC 4, we build on the knowledge that you've already gained in your FREC 3. So there's lots of similarities, recapping and things like that to make sure everyone is up to speed. So you cover life support, so you know your CPR and your ventilations of a patient if they're in cardiac arrest. However, in the FREC 4, you would do more advanced airway management. You would carry out more in-depth assessments and interventions with patients, so learning how to perform a 12-lead ECG and do basic interpretations of them as well as on the FREC 4 and it's not on the FREC 3. Understanding medical gases, how to administer them, the safety aspects around them and the legal aspects around medical gases as well. You would have a session on maternity care, so going right from caring for a mother who is pregnant to assisting with delivery and then care of a neonate and mother post-birth. You also go much more in depth with your trauma assessment, and that is another examined part of the course, but the level that we take it to on the FREC 4 is far more in depth and thorough with the interventions that you would be providing to a patient.
Okay, and with the FREC 3 and the FREC 4, what is the difference in kind of jobs that you can take on after that?
So with the FREC 4, as you've got a more solid basis of assessment and treatment of a patient, you can, within the private sector, you can do slightly more acute patients, so more unwell patients, because you've got the ability to assess the patient and take the history and understand what's going on, whereas the FREC 3 is things like first aid support at events and patient transport. The FREC 4 just allows you to take that slight step further into managing an acutely unwell patient.
Okay. So you mentioned about taking people's oxygen levels and whatnot. What kind of observations would you take following that on a patient?
So we've got a set of what we call basic observations or vital signs, and we carry these out on nearly every single patient that we come across pre-hospitally. Doing all of the observations together can give us a real clear indication of how unwell someone is. So are they big sick or little sick? What interventions do they need? But it also can help build an image of what their potential diagnosis could be. So the basic observations are heart rate, respiration rate, oxygen saturations, blood pressure, temperature and blood glucose. They're the basic vital signs. Having done all of those checks together, it can generate what we call a NEWS score. So a NEWS 2 score stands for National Early Warning Score, and this is a trending line. So basically we put an X on a chart with the number that we've got from that vital sign, and we do the vital signs every 15 to 20 minutes or however long is necessary depending on the patient's condition, and every time we do them they get another X on the grid and it'll show a waveform, and then we can see if a patient's improving, deteriorating or staying the same. And that's really important, especially with the current concerns in A&E with waiting times. We need to be seeing how we can monitor patients long term. So we'll start with heart rate. It's a really nice and simple one. Everyone's aware of it and everyone knows how to find one, or they've heard about how to find one. So checking your radial pulse or your carotid pulse, which is in your neck. So our heart rate, we're just talking about adult parameters here. Now it's important to realise that adults and children are different, and each age group of children is different to one another. So we'll just focus on adults purely here for the moment. So an adult heart rate can be anywhere between 60 and 100 as a normal expected heart rate. Anything lower than 60 is what we call bradycardia. Now that literally, brady means slow and the cardia is your heart rate. So slow heart rate lower than 60. Now if it's lower than 40, that can be absolute bradycardia. Anything above 100 is called tachycardia. So someone's heart rate between 60 and 100. Now, certain conditions can cause our heart rate to change. So our heart rate can elevate due to things like anxiety or panic, but can also be elevated when we've got an infection or a severe infection such as sepsis. So that's why it's really important to have a look at the heart rate. It can tell us how well the circulatory system, the heart, is working. We've got a respiration rate, which we spoke about in the primary survey. Now, an adult's expected respiration rate for someone who's not got comorbidities is between 12 and 20. Anything lower than 12 is a bradypnea, and anything above 20 is tachypnea. Certain conditions such as COPD or asthma can force those numbers to change, so it's important to understand someone's history as well when we're looking at that vital sign. And then we've got blood pressure. Now blood pressure, in my opinion, is one of the most important. It can tell us so much, but also it's a real indication of when someone's really, really overcompensating and struggling. So the blood pressure is made up of two numbers, the top number and the bottom number. And each number relates to something different. So the top number is called the systolic, and that is the pressure that's exerted on the arterial walls as the heart beats. The bottom number is the diastolic, and that is the pressure exerted on the arterial wall in between beats when the heart is taking that slight rest pause period. The higher the blood pressure, the higher the pressure is, and increasing risks of things like heart attacks and strokes. And that's why we get worried about high blood pressure. You hear so much about blood pressure in the media and like with diets and things. It is so genuinely important. So an expected blood pressure of a healthy adult would be 120/80. Now, there's a lot of scope for change in your blood pressure, and that can be due to personal circumstance.
Yeah.
So you do see a lot of, thin young women or frail elderly people that run on a lower blood pressure, and that is fine for them. So again, it's really important to understand somebody's history. So like I said, anything around 120/80 is perfectly normal. Going up to about 140 for the top number and as low as about 100 is still okay. We're not too concerned at all in those parameters. Anything lower than 100 for that top number could cause a patient to feel dizzy or a little bit unsteady. So again, it's important to ask certain questions if we get certain readings. And then anything over 100, you are entering into what we call hypertension, so high blood pressure. If it's 144, for example, I personally wouldn't be too worried. It's when we start getting into the 170s, 180s, or even over 200 that we are thinking, you're going to hospital. Now, local guidance does say that anything over 180 is what we call an incidental finding, and that needs to be passed on to either a GP immediately or taken to hospital to be treated. So it's just important to recognise that certain blood pressures are actually more severe than others. And then again, for that bottom number, we really want it to be below 90. Between 60 and 90 is ideal. So that's blood pressure. Having a low blood pressure could indicate that a person has got a significant infection or that they are losing volume somewhere, and that could be to do with a bleed or an infection. Or dehydration, that can also cause it. Then we've got oxygen saturations. So this is also nicknamed SpO2 or SATs, and that's the level of oxygen that is being transported around the body. Now we check this by using a pulse oximeter, and it's a small clip that goes over the finger, and it has an infrared light built into it that shines the infrared light through the finger, and a diode collects a signal. This signal then correlates into a number, a percentage. Now, the one thing that's really important for people to understand about pulse oximetry is it isn't always accurate in terms of it isn't always telling us what we think it's telling us. So pulse oximetry essentially is that infrared light is telling us how much hemoglobin is carrying something. It can't differentiate if it's carrying carbon monoxide or oxygen. It just knows it's carrying something. So if you go to a patient who's experienced a house fire, for example, and have suffered with smoke inhalation, they've inhaled carbon dioxide, carbon monoxide, depending on what situation they're in, and that's in their bloodstream, that's in their hemoglobin. So that pulse oximeter can't tell me this person has got 50% oxygen and 50% carbon monoxide or dioxide. It can only tell us that 100% of their hemoglobin is carrying something. So 99% of the time, we can trust that pulse oximeter because patients haven't been exposed to things like inhalation injury. But again, it's just an anecdote that's really important to understand.
Circumstances.
So normal oxygen levels should be above 96%. However, if you've got something such as COPD, which is chronic obstructive pulmonary disease, which is an umbrella term for lots of different respiratory diseases such as asthma or emphysema, you may have different target levels, and the most common target level for someone with COPD is 88 to 92%. And then we've got blood sugar, which brings us to our final basic vital observation. Now, blood sugar should not be routinely carried out on every patient that we do observations on, and that's because it's an invasive procedure. You have to take blood via a finger prick test. So it's always important to ensure that we're getting appropriate consent before doing that observation, as it is invasive. But a normal blood sugar level reading for someone who is not diabetic is normally between 4 and 9. However, if you have just eaten something extremely sugary or had something to drink, that may be slightly out. It's also important to remember that people who aren't diabetic are slightly more tolerant to having slightly lower blood sugars. So anything above 3.5 for somebody who is not diabetic is absolutely fine. However, if it's a diabetic patient and they've got a blood sugar of lower than 4, then that's concerning, whereas it's lower than 3.5 for a non-diabetic patient. Anything above 9 is indicated it's high blood glucose levels. However, it's above 18 when we start to get very worried.
Yeah.
Anyone with a persistent blood sugar of above 18 needs transport into hospital unless they've got a documented reason as to why that may be, as it could be something called diabetic ketoacidosis. And I was wrong, that wasn't the final observation, because of course we've got temperature.
Yeah.
So in my personal experience and opinion, tympanic temperature, so putting a probe into the ear, is the most accurate and effective way of gathering temperature pre-hospitally, as the ones that you place under the tongue are not hygienic, and the ones that you place under the arm or scan on the forehead just are not as accurate as a tympanic. Now, our temperature should be anywhere between 36.1 and 37.5 as a normal parameter. Anything lower than 36 is hypothermic, and anything above 37.5 is pyrexic, which means a high temperature. However, we're not particularly worried between 37.5 and 38. That's just very low grade fever. But it's when we start getting above 38, especially that 38.8 cut-off mark, is when we're thinking we've got some sort of infection that we're really struggling to fight off here, or something's going on that we're struggling to deal with. Now, all of those observations taken together can give us a really clear indication of what is going on with the patient. If we've got a normal heart rate, a normal blood pressure, a normal temperature, a normal blood glucose, but our rest rate and our saturation levels are out of whack or out of parameter, then we need to be doing a more thorough respiratory assessment, because it's all pointing to our respiratory system. However, if we're ill and it's left untreated for whatever reason, other observations will start to take toll because our body's starting to compensate or overcompensate. So if we're breathing really quickly for a prolonged period of time, our heart rate is going to elevate because we're struggling to breathe, and therefore our body still needs to circulate oxygen, so our heart is working harder to do that, and vice versa. They can all go hand in hand together.
Okay, thank you.
Any questions?
No, I don't think so. You've explained it very well.
Lovely stuff. So that's the end of the podcast. That's podcast number 1 completed. So just to recap, we went over patient assessment with primary survey and vital observations. If you've got any questions, leave them in the comments and we'll get back to you. Thanks. Bye.